Here on CoastLife, we like to keep all of our community members safe and informed. And today we're going to be talking about COPD. And honestly, Paige and I, we really don't know that much about it. So maybe you're in a similar boat to us.
Yeah.
And so here to tell us a little bit more about COPD are Bev and Sarah here with Peninsula Home Care. Welcome.
Thank you.
Thank you.
Thank you for being here.
Yeah.
So tell us a little bit about, you're here telling us about COPD and just some general information, I guess. What are some things that people should know, look out for, things like that?
Sure. So I'm actually going to let Sarah share with you. So Sarah and I recently partnered up together, and Sarah is with the Southern Delaware COPD Coalition. She's a respiratory therapist, and so she has really making it her life's mission to take care of COPD patients on a very large scale. Wow. So I'm going to let her share some of that with you.
Yeah,
please.
Okay, yeah, so I started the Southern Delaware COPD Coalition a year ago. I saw my first patient last September.
Okay. Congratulations.
Thank you. It's been a very exciting year. The good news is that we've made a lot of connections within the community, and that is benefiting our patients, and that is truly our goal. That's why we're here. That's why we do what we do. So essentially the coalition, we bridge gaps in care, and we try to reduce any barriers to care for people with chronic lung disease in the communities.
Okay,
and that's used. This time of year is really important. Flu season is here upon us, with COVID still lingering and RSV here as well, or on the way. It's really important that people with chronic lung disease take very proactive measures to keep themselves healthy.
Absolutely.
And that includes things like vaccinations, following up with their providers, and just making sure that they're aware of their signs and symptoms, so that if they do start to develop a respiratory infection, that they're aware of it and they proactively address that.
So I guess maybe let's talk about some of those signs, symptoms, maybe either somebody who has a diagnosis of chronic lung disease or maybe doesn't have that diagnosis and they're not sure. What are some of those signs?
So if they have signs and symptoms would be cough, shortness of breath, that gets worse with activity most likely, but anything if they've had an extensive smoking history or if they've been exposed to particulate matter or chemicals in the work industry, it's really important that they talk to their doctor about any symptoms that they have so they can get the proper diagnosis. And once they do that, this time of year especially, it's really important to be mindful of their symptoms. So if their symptoms get worse, if they have a cough that's lingering and it gets worse, or if they have mucus production, increasing shortness of breath, these are things that they really want to be aware of so they can communicate that to their provider and they can get in and get an appropriate diagnosis.
Okay, perfect. And what does your job look like? How do you help someone once they have COPD?
So my job, I worked in the hospital for 20 years, and I left that hospital setting to help people because I kept hearing, and anyone in healthcare has probably heard it, outside of the hospital there really isn't that substantial resource for people with chronic lung disease. So we're working with Peninsula Home Care to be in the home care setting so we can really meet these people where they're at. A lot of times we see things and we hear things, but until you're actually in the home environment and can see what the patients are dealing with, it brings a different perspective. And so that's been really exciting over the last year.
It's been really helpful to partner with Sarah because she has a specialty that so many of our patients, we have found that as they're leaving the hospital and they come to us for home care, and like Sarah said, it's RSV season, which is a respiratory virus. If you have COPD, you're already lung compromised, and many of our patients just don't know. They get so much information in the hospital, they come home, and it's really hard to remember everything they were told.
Yeah.
To partner with somebody like Sarah for us is so crucial to all of our nurses. Our nurses have other specialties, but to add respiratory therapy to that mix just allows us to better educate our patients and hopefully help them stay well as they're moving forward with because it is a long-term disease, it is a long-term illness, and they should be educated and know what they need to do to take care of it.
Yeah, I think having that education with your patients is huge. And I mean, I know when you do, anytime you go home from the hospital and they hand you a stack of paperwork and you're like, I don't know what any of this means.
And then when you can't breathe on top of it, that adds a whole nother layer. So we really want to help bridge those gaps. We work collaboratively and holistically. It can't just be respiratory therapy or nursing or PT and OT. It has to be a collective effort here, and that's what we're doing with this partnership. So it's been amazing.
Yeah.
Awesome. So maybe for people who are struggling with COPD and they're looking to look for somebody who is bridging those gaps, how can they get in touch? How can they be involved?
Yeah, sure. They should call either one of us. So they can look for Sarah at the Southern Delaware COPD Coalition here in Delaware, look her up, call her, because she can give you a lot of direction, whether it's just with her, with a physician, or with home care, or you can even call us, because we would give you that same information and direction to refer you either to a pulmonologist or connect you with Sarah for more education, or certainly call your physician to engage you in home care. So if you call either Peninsula Home Care in Seaford, Delaware, or the Southern Delaware COPD Coalition here in Millsboro, you can get a wealth of information, and we're happy to help.
Yeah, great. Well, thanks for being so accessible and for really taking the lead on this, because I think everyone can agree that you heal a little different at home than the hospital, and that healing should be better and more long term.
Absolutely.
Great. Thank you so much.
Yeah,
Thank
you so
you.
much. Thanks for coming in.
Of course,
Anytime.
of course,
We love learning.
Yes.
Thanks for having us.
We do.
Get your flu vaccine if you haven't gotten it yet.
Yes.
There you
If
go.
you're compromised, RSV and COVID, talk to your provider if you're not sure. It's really important.
Yes.
This is a very critical time of year. We want to keep people healthy, out of the hospital, improve their quality of life, and there's a way to do that.
Yes. A great reminder for everybody.
Yes, it is. It is.
Well, thanks again for coming in. We appreciate having you guys. But don't go anywhere, because we do have Smart CoastLife coming your way.
Perfect. Thank you.
This segment of CoastLife was brought to you by Peninsula Home Care.